Hi there, how are you? Monica Agarwal, nice to see you. Keep them up, have them in the middle of your morning when you're working, running between patients, it's okay. So I've been in practice for 10 years and I would admit that I've given out more Lipitor and Crestor prescriptions than most people because as a cardiologist, that's what we do. What I found that is I kept feeling like I was just giving out more and more medicine, and yet I wasn't making people better somehow. And I also, like many people, feel that, what am I doing here? We as physicians are taught to tell people, well, eat better and exercise more. But we don't really tell people or give doctors the tools so that they can then counsel their patients better. And so what we're trying to do is change that model. I want people starting to realize that even as employees and staff of the hospital, that what you eat matters. The things that you do when you're young impact your whole future. Start changing your habits now and you'll be able to walk better longer. Your joints aren't going to hurt. You're not going to be a 30-year-old with diabetes. All of these things change if you just make the first step now.
So about a year ago, Dr. Agarwal partnered with myself and the food and nutrition team to conceptualize the introduction of a plant-based menu, specifically to start out with our patient population. We have really researched the benefits of introducing plant-based foods into daily cuisine for not even just our cardiac patients, but really our population as a whole, and some of the preventative benefits it does have to health. And then what we did was really work very closely, again, with our clinical team, with our culinary team, to design a plant-based menu that really does meet the food preferences of our population here in Gainesville, Florida.
We sat down multiple times throughout the past year, kind of brainstormed, developed different menus, different ideas.
We conducted meal tastings, including our nursing staff, as well as some other staff members in the organization, to get their buy-in and to tweak our recipes.
You get the dietary staff involved and you get them excited about it, and then you start teaching the nurses about what the food is and letting them taste it, and then they tell the patients, like, I tried this is really good, and then the patients start feeling less intimidated and less fear.
Sometimes when they look at the menu and they're a little bit hesitant to try something new, but once they do receive that meal, they're pleasantly surprised with the taste and the flavor of it.
I think that's important to remember that we're not feeding people just lettuce. We're giving people fabulous food. It tastes good. There's different types of flavors.
We do a sweet potato kale hash. We do a lentil bolognese over pasta. We do a tofu vegetable stir fry.
Our next phase is to really start incorporating the plant-based items into our retail operations, such as our cafes, to really promote this same initiative and this same healthful philosophy to our employees and our visitors that come in our door every day.
Let's do this together. Let's not be afraid to make a little bit of a change in your hospital. It takes small steps at the beginning, but I'm confident that we can do it as a group.
You might have some people who might, tilt their head a little bit when they first hear it, but I guarantee if you work through that, and again, if you bring it to them and really engage them in the process, it can work. It can work, and it does work, and it really does make a difference.
People often say that it's hard to change, or that people can't change, and it's just easier to give out a medicine. Boy, I hear that all the time, sometimes every day. I don't agree with that. I think that change is hard, but change is good, and then it takes time. But I think that we underestimate sometimes what people are able to do. And so sometimes when you give people the tools, they will make the changes. Not always immediately, but they slowly do. Our job is to just start the process.